So my group has decided to focus on the different barriers that people face when it comes to understanding health and science. Many of the barriers society faces range anywhere from economic, religious, social, and educational barriers. I want to focus on how education can be a barrier when it comes to understanding science and health. Many people who are educated understand most basic science and health-related issues because they have had some formal type of education. However, for those people who never received a solid education, most science and health-related topics are completely new. I believe there's a direct correlation between one's understanding of science and health with the community in which one was raised. It is evident that many communities in the United States have higher median incomes per family and therefore they have better access to better education, which results in a better understanding of health.
Due to educational, culture, or language barrier, many scientific information in the literature can be misunderstood by the public. For instance, when dealing with topics like genetic modification, not understanding the entire science behind it, one might assume prematurely that science behind medicine is not trustworthy and thus compromising their health. Also, many social media can and is manipulating these aspects to cause confusion and general distrust against science and health. I believe enhancing the general education level could close the gap between science and the public and eventually remove the barrier to health.
My project is on a language barrier because without a commonly understood language, it is difficult for doctors to communicate with their patients, and so that creates a barrier for patients into understanding their health. So when I was younger, my mom and I often needed a translator whenever I went to a doctor's appointment, and it made the communication a lot more effective. And later on, I had the chance to shadow a doctor in a medical center that serves minorities, and she told me that her Vietnamese was at the very basic, and so that also presents another language barrier. But I was able to see both the sides of patients and doctors. And coming to college, I'm exposed to programs such as Labor Coach, where bilingual students are able to serve pregnant Asian women during delivery time, and they help by facilitating conversation between the doctor and the patient. And so these programs have the potential to bridge the gap between language and health.
So my part of our group's final project focused on evolution and how that pertained to being a barrier in understanding science. So I wrote my final project on just juxtaposing how as a young child I grew up in a conservative religious community but yet was interested in science, and how I saw a backlash against science in my religious community, but how I continue to be interested in science, continuing on to my teenage years and also in college as well. So I wrote how evolution or distrust in evolution can lead to a distrust of science in general, and also how that distrust leads to general health issues and issues such as lack of belief in vaccination and also in global warming.
Also drawing from personal experience, I feel that with new policies, innovations, and changes in medicine occurring daily, it's becoming increasingly difficult for the public to have a strong grasp on understanding what happens to their health and healthcare in general. And I witnessed this miscommunication, misunderstanding in my house with parents who don't hold college degrees, are limited English speakers, and live in an underserved community. Since there's a lack of dissemination on the sides of research and policies, they're often misinformed or uninformed about scientific and health topics. Recently with the ACA, my parents didn't even realize that their Medi-Cal benefits became more comprehensive and that they were able to schedule an appointment with their doctor that they had been putting off for a long time. And I see a relationship between understanding and health, and I hope to improve this, especially in vulnerable communities, by looking at how to properly disseminate information to the public.
So there are a number of barriers that lead to misunderstanding in relation to public health crises, even though there are scientific resources out there that are largely available that could prevent these issues. So a recent demonstration of this disconnect is the recent measles outbreak, which has been proven to be entirely preventable through vaccination methods, but yet there's still a lot of controversy and misunderstanding surrounding the issue. So a huge factor for this, I think, is the news media, which has been known to really affect the public by emphasizing controversies and myths which have been known to be disproven by science but still have a big impact on the public. Also, there are a variety of medical resources that can provide an understanding for these issues, but obstacles such as language barriers and a general distrust of science are preventing access to these resources. Finally, the business side of healthcare is a major issue for hesitation from getting vaccination because doctors are not compensated for the time that they spend trying to encourage patients to get vaccinated. So there's really a lack of incentive from the doctor's point of view to reach out to the general public. So that's why there's many factors that are preventing resolution of the health crises.
So as my group and I explore barriers in attaining higher or formal education and learning technical terminology and accessing resources such as scholarly journals and even in being exposed to the field of science, we see how all these barriers interconnect and play a role in how the public internalize information to make decisions about their health. We need to figure out a way to better educate the public on the science and the information about health before they reach the term of their diagnosis, and that's when they're first learning about what their health is on.